wishing you all a very good morning on behalf of World Hypertension Day, which falls on May 17th of every year. Hypertension is a very common disorder which occurs in about 30% of adult population in India. It is the major cause for cardiovascular disease, heart failure, stroke, and kidney disease. But the good news is control is possible through diet, exercise, and the drugs prescribed by your doctor. And it is very important also to self-monitor your blood pressure at home correctly. BP right karo. So how do we check correctly the blood pressure at home? You have several electronic meters which are available. And when you use the cuff, it should fit in with your hand, at least 3/4 of your arm circumference should be comfortably covered by the cuff. If it is too small or too big, you will get incorrect readings, which will vary from 5 to 10 millimeter mercury. And whenever you measure the blood pressure, it is very important to avoid coffee, smoking, and a heavy meal at least half an hour before recording. And you should not have exercised or walked and then immediately record your blood pressure. You must be seated comfortably for at least 10 minutes before you record the blood pressure. And when you record the blood pressure, it's very important that you are seated comfortably with your back rested on the seater and your heart level. The arm should be placed close to the middle of your chest, the same level. And it should be rested on the table. It should not be hanging or it should not be lifted up. It should be kept on the correct position, and then the recording should be done. And your bladder should not be filled. So you should empty your bladder, go to the restroom, pass urine before you measure the blood pressure. And your knees and legs should not be kept crossed, which can increase your blood pressure up to 5 to 10 millimeter mercury. And you should always support your feet comfortably. And you should not be talking, or you should not be actively watching a movie or something which will make you tense or increase your blood pressure. So in a calm surroundings, comfortably seated, using the right cuff and on an empty bladder, and not immediately after a meal, will give you the right recording of the blood pressure. And this blood pressure should be 120/80 for a normal individual, and for a person with hypertension under control, it should be less than 140/90. If it is so, there is nothing to worry. If it is not, you must approach your doctor to adjust the medications immediately. By doing the right things and monitoring your blood pressure regularly, having less salt, less fatty food, and regular exercise, you can control your blood pressure easily, and there is no need to be afraid of hypertension. And this message comes from Dr. Asha Mahilmaran. I'm a consultant cardiologist from Apollo Hospitals, Chennai. Take care and take care of your blood pressure. Thank you.